Labour's started, so perhaps you felt the onset of your contractions. How often might I feel contractions? So to begin with, the contractions are quite irregular. You may be aware that they're coming every 10-15 minutes, lasting maybe 20-30 seconds. And what should I do during that time? Well, we've talked about that the commonest time for birth to start is at night. And just to share with you a little bit about my birth story. So my first contraction was at 1 o'clock in the morning after having 2 hours of sleep. As it came on, I'd never felt anything like it before, so I got excited because this was a sign that my baby was on its way. But actually I'd only had around 2 hours sleep at this time. As the contraction came on and I was laid down, it didn't feel comfy, so instinctively it felt right to stand up, to stand with my hips far apart, to sway gently side to side, and to concentrate on taking nice, long, slow, deep breaths. So what I would suggest to you is that actually if your birth is underway at night and you haven't had much sleep yet, that the most important thing you could actually do in those early stages is to both try and get some rest. Yes, it's important to be upright, forward, open, to be active once the contractions get underway. But remember, the early part of birthing is that piece of string, and from your very first contraction, you don't know how long your piece of string is going to be. Perhaps it might just be a couple of hours, but it could be that it's much longer than this, and you might have 8-12 hours or even longer of irregular contractions as the cervix prepares for birth by thinning and softening and shortening and losing that length. So I'd suggest to you the rest is more important at this point. The contractions may carry on in this irregular pattern for some time. It might be that they kind of almost stop and fizzle out and you have a period where you don't feel anything, and this is really, really normal in the piece of string and particularly with our first baby. So both try to get some rest. But perhaps you aren't able to rest, perhaps it's during the day and you choose to do something a little bit different. In that case, I would then advise you to use the power of distraction and try not to clock watch. Your birth will be as long as it's going to be, and actually sometimes keeping on looking at the clock and watching those hours go by can help to lead to anxiety and actually not help you to keep calm and relaxed. So perhaps watch a box set, perhaps watch a film that's going to make you laugh and take your mind off it. Perhaps meet up with a friend for a coffee, perhaps go out for a walk, maybe take the dog for a walk, but doing something just to keep your mind off it whilst you're in this piece of string phase. As birth progresses, the contractions are likely to come closer together. So maybe you felt them every 10-15 minutes, and after a couple of hours, you start to feel them more regularly, maybe every 5 minutes. Maybe having lasted 30-40 seconds, they're now lasting nearer a minute. And this is generally a good sign that you're getting to the end of that piece of string and that your body will then start to work more efficiently through the birth process. When is the right time to come into hospital? Well, this is going to be a personal choice and dependent on many factors, contractions just being one of those. Typically, as a good guide of getting to the end of piece of string and the body working more efficiently and entering what we call the established or the active phase of birth, the contractions are probably going to be coming every 3 minutes and lasting a full minute, and likely to have been coming in that pattern for a couple of hours. So I'm going to talk about 3-2-1. So contractions that are every 3 minutes, that have been like that for around 2 hours, and that are lasting for a minute, is typically a good sign that labour is past this piece of string and entering a more active phase. But what else might influence your decision? Well, perhaps where you live. So do you live in Harrogate and hospital is a 5-10 minute drive away? Or perhaps you live on the north side of Leeds. Maybe it's coming up to 5 p.m. and the rush hour traffic, and that might make you a little bit anxious about getting to the hospital in time. If you want to discuss this with a midwife, then give us a ring. Maternity Assessment Centre, Monday to Friday, 8 till 8, or outside of those times, delivery suite, and we can just help give you a little bit more guidance. What do I do though if actually my contractions aren't 3, 2, 1? Actually, my contractions are 7 minutes apart. They've been way longer than 2 hours. They've been maybe coming like that for 12 hours, and they're not quite lasting a minute yet. They're lasting around 30 to 40 seconds still. But I've tried everything I can at home. I've tried a bath, I've tried paracetamol, I've tried being distracted, I've maybe had a warm bath, and actually I'm finding it really hard to manage these contractions. I don't feel like I'm coping very well, and I'm getting quite frustrated that this has been going on for some time. By all means, give us a ring, and the midwife can just reassure you that this is really normal, that you're likely still in the piece of string, and we know the best thing is likely to stay at home because you're going to get more rest at home and be more comfortable. But if you wish to come in at this point, then by all means you can come in and we can give you a check over. But it might likely be that the midwife still advises that there's some way to go and would then suggest to go home and continue with those coping mechanisms at home with the support of your birth partner. Contractions that are coming more regularly and ending the piece of string and getting into the more active birth phase, then typically you would have 6 to 12 hours of more regular contractions coming every couple of minutes and lasting for a full minute to take you to the point of your baby being ready to birth. Some ladies take a little longer, some ladies do it a little quicker. Keep doing all the things you've used at home to cope with this process. At this point, you're likely not to be able to rest, and your body will instinctively or intuitively tell you that you want to be active, you want to be upright, forward and open, because this is helping you feel much comfier with the contractions. Even at the point your contractions are coming regularly, perhaps every 2 minutes, every 3 minutes, you're still going to get more period of time where you're able to get rest in between contractions than the actual contractions. So what I would say to you is you're actually going to get more rest than you will the contraction. So take the opportunity to rest in between, to have something to nibble on, to keep your energy going, to sip away at plenty of fluids. It's important that whilst you're taking those fluids on board, that you also think about the importance of your bladder care during birth. If I demonstrate to you with the pelvis, if we imagine this is the space for your baby to birth through, if your bladder is filling, you can see that it's taking a lot of space up there, and that is space for our baby to move down through. If the bladder is nice and empty, you can see that that's not taking the space up. And sometimes the sensations of birth can interfere with our body's sensation that the bladder is filling and we need to empty it. What I would ask is that you remind your birth partner to remind you during birth of the importance of emptying your bladder. So every 3 to 4 hours, this can be a role for your birth partner to remind you gently between contractions. Typically during a contraction, you won't thank them for reminding of you of this, but wait for the contraction to pass and then to say, you know, it has been a couple of hours. Do you want to try sitting on the toilet and trying to have a wee? And then you can take the opportunity to do that. Sometimes the urine passes easily, other times it might be you find it difficult to relax, and just sometimes sitting on the toilet, then eventually that urine will flow. If you really don't feel like you need a wee, then think back and actually, how much have I had to drink? Have I literally just had a few sips and I need to increase my fluids? My body's working hard, but in a way that it's perfectly designed to do, and I need to keep hydrated to help that process.